Compromised conduction of depolarization from the atria to the ventricles is termed atrioventricular or AV block. First degree AV block is said to be present if every P wave is transmitted to the ventricles, but with a prolonged PR interval. Second degree AV block is characterized by some P waves intermittently failing to conduct to the ventricles. Mobitz type 1 second degree AV block is identified by progressive prolongation of the PR interval in the group of complexes before the non-conducted P wave. In this Wenckebach phenomenon, the longest PR interval on the rhythm strip is immediately before the non-conducted P wave, while the shortest follows immediately after. In the more sinister Mobitz type 2 second degree AV block, the PR interval is constant before the non-conducted P wave. Third degree AV block, a complete lack of communication between the atria and ventricles, is characterized by the absence of any relationship between P waves and QRS complexes.